19 February 2014, the 2-year-old male dwarf hamster has been dragging its left hind leg for the past 5 days and has been brought to Toa Payoh Vets 3 days ago.
Today I'm checking on this hamster. The weight is 57 grams. The hamster has been on steroids to reduce the swelling, and the swelling has gone down. The swelling, as you can see, is on the left hip area, and that's why the hamster can't walk properly, because you can see it's dragging his left limb, and that's why the owner is concerned. Okay, now you can see this lump on the left on top of the hip as compared to the right. There is no lump here, and this is the hip, and on the left hip there is a lump, a big swelling actually. So this big swelling is likely a subcutaneous tumor, and the solution is to remove it. But the problem is that this hamster is quite old, and the tumor or the lump is so huge that the muscles may be involved. So that's the reason I hospitalized it for 3 days to give antibiotics and anti-inflammatory to reduce it, reduce the heart swelling. Now this heart swelling is unlikely to be an abscess. Of course, it's possible there is an abscess too. So only by surgery, under anesthesia, do we know what it is. But as you can see, the hamster can walk normally actually. He can walk normally, but it's no more dragging now because of the drug. So you have to, the owner has to take a decision as regards the anesthetic risk, because it's a great risk since the hamster is quite old. And I have to call the owner today and see what she thinks about it, because sometimes the hamster will just pass away after the surgery due to the hamster being old and unable to take the stress of anesthesia. But if you don't operate, the hamster can't walk properly, and then the lump will be growing bigger and bigger. So there's really not much choice as far as the owner is concerned. So I will call the owner today and let her know again that this huge lump is actually a large one, and there's a significant risk of the hamster dying during the operation. And if the lump has involved the muscles of the hip, then obviously you can't operate, it becomes inoperable. Okay, so this is the situation. If the lump is operable and the hamster survives, then it will have a lease of life, you see. If not, then it will pass away on the operating table. So this is why it is important to let the owner know the risk. And overall, it's quite a nice hamster. He doesn't bite anybody, and he's lost a lot of weight. Actually, he was heavier at that time. He came in 3 days ago. He was around 61 grams. Now he's 57. So he lost 4 grams. And but he's still eating. He's still eating and drinking, and he's quite active now. So you have to wait and see. February 19, 2014, Toa Payoh Vets. Okay.